Ever wonder why American healthcare is so incredibly expensive and just ridiculously complicated? Well, to really get it, you have to look past the political shouting matches and go back about 100 years. It turns out there's this hidden story, a series of decisions that all seemed like a good idea at the time, but accidentally created the very mess we're in today. So let's go find that first domino.
You've heard this a million times, right? Turn on one news channel and you'll hear that the free market was working just fine until the government came in and messed it all up. Flip the channel and you'll hear that the system was totally broken, so the government had to step in and fix it. It's an argument that just goes around and around in circles. But what if? What if they're both missing the point?
This is where the source material for this explainer just hits the nail on the head. Both sides have a tiny piece of the truth, but they're both mostly wrong. See, the real story isn't about one party or one bad law. It's about a long, slow chain reaction of unintended consequences, where every single fix just accidentally set up the next, even bigger problem.
Okay, so here's the plan. We're going to follow the trail of dominoes. We'll start with how we decided who gets to be a doctor, then we'll unravel the crazy way we pay for it all. After that, we'll see how the government's quote-unquote solutions led to jam-packed ERs and a literal mountain of paperwork. Every step explains the next one.
All right, let's rewind all the way to the beginning. The very first big change in American medicine had nothing to do with insurance or how much things cost. Nope, it was all about controlling who could even call themselves a doctor in the first place, all in the name of making things better.
You know, back in the 19th century, it was kind of the Wild West of medicine. Pretty much anyone could hang up a shingle and say they were a doctor. So the AMA was formed to create some standards. Then came 1910. And this thing called the Flexner Report just blew everything up. It led to a massive overhaul, closing down tons of medical schools and making the path to becoming a doctor way longer, way harder, and a whole lot more expensive. And hey, the goal was higher quality, and they got it. But there was a catch.
The economist Milton Friedman had this absolutely brilliant way of explaining the unintended consequence. He said it's like the government passing a law that says every single car sold in America has to be a Cadillac. Sure, the average quality of cars on the road would be amazing, right? But what about everyone who could only afford a basic Ford? They'd be completely priced out, unable to buy a car at all. By making every doctor a Cadillac, we also made them a luxury good.
And this wasn't just some small dip. Look at this number. In just 30 years, the supply of doctors compared to the population fell by almost a third. We got better doctors, for sure, but we also got a lot fewer of them. And basic economics tells you what happens next. Less supply means less access and higher prices for everybody. This was the first domino.
Okay, so domino number one is down. We have fewer, more expensive doctors. Now for the next piece of the puzzle, which is maybe even more important, how we started paying for those doctors. This next step completely shattered the connection between a patient and the actual price of their care.
You know, for the longest time, things were pretty straightforward. You got sick, you saw the doc, you paid the doc. You could even haggle over the price. But then the Great Depression hit, and a brand new idea popped up that, at the time, seemed like a total game changer for everyone.
So these new companies like Blue Cross Blue Shield started offering insurance that wasn't just for catastrophes. It covered regular doctor visits. And in exchange for tax breaks, they used community rating, meaning they charged everyone the same premium, whether you were healthy as a horse or chronically sick. This created a huge problem that economists call moral hazard. I mean, think about it like an open bar, right? When someone else is picking up the tab, you don't really care how much the drinks cost. People started using a lot more healthcare, and that's when prices for everyone started to climb.
Friedman explained this perfectly too. Look at this chart. When you spend your own money on yourself, that top left box, you're looking for the best value. You care about quality and price. That's where healthcare used to be. But once insurance stepped in, we moved. Now you, the patient, are in the bottom left box. You're spending someone else's money, so you still want the best quality, but you couldn't care less about the price. Meanwhile, the insurance company is in the top right, spending their money on you. They want to cut costs, but they don't really care about the quality you get. It's a system designed for conflict.
And then, of all things, World War II comes along and accidentally locks this whole messed up system into place for good. The government froze wages so companies couldn't offer more pay to attract the best workers. So what did they offer instead? You guessed it, health insurance benefits. And that right there is the historical accent that explains why most Americans get their insurance through their job. It cemented this third-party system and shoved healthcare straight into that awful bottom right quadrant, somebody spending someone else's money on a third person. It is the most inefficient way to spend money imaginable.
So now we've got a system where costs are just spiraling out of control.
And that's when the federal government decides to step in a big way, with a bunch of major solutions. But as we're about to see, every single fix just created a brand new, even more complicated problem.
And this is where things really start to accelerate. Problem: rising insurance costs are pricing out older Americans. Solution: the government creates Medicare in 1965. New problem: holy cow, Medicare costs are exploding. New solution: the government forces price controls on hospitals. New problem: now hospitals are losing money on some patients, so they start dumping them, refusing to treat the unprofitable ones. It's just one thing after another.
And all of that chaos, that problem of patient dumping, leads us to the final and maybe the biggest domino to fall. It's a law that was passed to solve that one specific problem, but it ended up completely transforming every single emergency room in America.
The law is called EMTLA. Now, on paper, this sounds great, right? It says hospitals can't turn away anyone who shows up in the ER. But look at the fine print. The penalties were absolutely brutal. A hospital could lose all of its Medicare funding, which is basically a death sentence. A doctor could get hit with massive fines that their insurance wouldn't even cover. And crucially, Congress didn't provide a single dollar to pay for all this new care. It was a mandate with a giant stick and an empty wallet.
And the result was, boom, overnight, the government basically turned every ER in the country into a free clinic and the nation's default safety net. Hospitals had to eat the cost for all this uncompensated care. And if you've ever wondered why ERs are so crowded, or why your hospital bill has those insane, unbelievable line items, this is it. This is the reason. They have to shift those costs onto everyone else to stay afloat.
Okay, so as if all that wasn't complicated enough, there's one last layer of misery piled on top that touches every single doctor's visit. A soul-crushing mountain of paperwork that has buried doctors in administrative work.
See, to try and get a handle on all those rising costs, the government created these unbelievably complicated billing systems. So now, instead of just using their medical judgment, a doctor has to fill out these insane forms, checking dozens of little boxes just to justify their decisions and get paid. The system is so nuts that a patient could come in with a knife in their chest and they might not qualify for the highest level of care billing because the doctor couldn't get a family history while they were, unconscious. It's completely absurd.
Then came the big push for electronic medical records, or EMRs, and listen to how one of the ER doctors from our source material describes it. He says that without the clunky EMR system, he could see patients almost twice as fast, and worse, it created a single point of failure. If the computer system goes down, the entire emergency department can just grind to a halt, putting everyone at risk.
And then, for the final 1-2 punch, the government does this. First, they force every hospital and doctor to use these complex, clunky, and often vulnerable electronic systems. Then, they create HIPAA, which brings down these incredibly severe punishments for the data breaches that were basically guaranteed to happen on the very systems they forced everyone to adopt. It's the ultimate insult. Mandate a flawed system, then punish people when it inevitably fails.
This picture just sums it all up perfectly, doesn't it? This is where that 100-year journey of good intentions has led us. It's a system so completely buried under layers and layers of rules and regulations, each one designed to solve a problem, that it's become a labyrinth that's almost impossible for anyone to get through.
So at the end of the day, what have we seen? We've traced a century of dominoes, where every well-meaning solution, from making doctors better, to insuring the elderly, to mandating electronic records, ended up creating the next bigger crisis. Which leaves us with one really important question. If that has been the pattern for 100 years, what does that tell us about the next big solution that's just around the corner?